Hey everybody, Joe Ruzick here, physical therapist. I have something I want to talk about regarding SI joint dysfunction. So first of all, what is SI joint dysfunction? People say, I have an SI joint problem, I have an SI joint dysfunction, I have a unstable, out of place SI joint. So first of all, I get this question a lot from my patients, so I thought it'd be good to elaborate a little bit. First of all, what is the SI joint? We have to understand what the heck it is before we really can understand the conversation around what's dysfunction. So think of the SI joint as where your forces from your upper body meet the lower body. It's where the spine meets the hip. So sacrum, right? You think of the bottom of your spine, you have kind of that triangular shaped, maybe more like this, triangular shaped part of your spine. Then that butts right up against iliac, means hip. So sacrum, sacro-iliac joint, ilium. So it's a very important joint where forces meet. So I would say all the forces that come from the top, upper body, weight, carrying something, etc., have to meet the ground reaction forces, or forces coming up from the ground from your feet at that joint. It's kind of like a force coupler in a sense, all right? So that's really what it is. It's a critical joint, and why it can be a problem is because of that it's where those two things meet, those two forces meet. So then we get into, what is sacroiliac joint dysfunction? That's a big phrase, okay? Really, it's typically looked at in two ways. That either we say that the joint is too loose and it's coming out of place, it's malpositioned, as I'd say, or we say, well, no, that doesn't occur, yet we have pain from the joint. So let's talk first about the out of place issue, the out of place argument. And this is a topic of debate. It's definitely a significant topic of debate among people who treat this kind of problem, PTs, physicians, chiropractors. So here's the way to think about it. The first way to look at it, the first camp would say that joint is kind of like a mountain range. It's kind of locked together. It's kind of like these jagged congruent forces, and they're locked together and held together by ligaments and muscles, and just the way the joint is built, it's kind of like pushing into each other, so they're pushing together. And those folks would say, you really can't have that thing out of place because it's so congruent, it's so joined together. They would also say that if you think you're going to, look at somebody and say, usually you do this from the front and the back, put your hands on their hips and say, well, this one's higher than the other. So let's exaggerate for emphasis. If we were up like this, we'd